Well, as the COVID-19 vaccine rollout expands to phase 1B, there are a lot of questions coming into our newsroom. And joining us now to help us get some answers is Dr. Summer McGee. She is the Dean of the School of Health Sciences at the University of New Haven. Dr. McGee, thank you so much for being with us.
Thanks for having me.
So one of the big questions that we keep getting is if you recently got a vaccine, say the flu shot or the shingles vaccine, do you need to wait to then get the COVID-19 vaccine?
It would be best to wait at least 2 weeks, 14 days before starting your course of the COVID-19 vaccine. You really don't want to pile these vaccinations one on top of another and have your immune system overreact to all of this new information that you're introducing to your immune system.
In terms of those vaccines interacting negatively with the COVID-19 vaccine, is there any concern of that?
I think what you really want to avoid is just overstimulating the immune system such that you might have, some kind of allergic reaction or some kind of shock to the system. And so, again, we don't know a lot about this. This wasn't something that was rigorously studied in the trials, but we want to avoid any potential side effects or problems with either of those vaccinations by stacking them one on top of the other.
That makes a lot of sense. We've also had a number of people asking us about they've received their first shot, but they may not be able to get their second part of the vaccine in the allotted 3 or 4 week time. How big of a deal is that? Does it matter?
Typically, when you get a vaccine, it's a big deal to get the vaccine, the second dose, too early. It's not that big of a deal to get it a little bit later. So if you're not able to get a vaccination appointment on the exact day, day 21 or 28, depending on which vaccine you got, it's not that big of a deal, but do try to get that second vaccination as close to that date as you possibly can.
All right, I think you helped clarify a number of things for a lot of us, so we appreciate that. Dr. Summer McGee, thank you so much for your expertise.
Thanks so much.